Hey guys, it's Miss Jackson, and I'm going to give you guys a run through on simulation so that you guys can be more comfortable when you come into sim so it's not so scary. I want to first say that when you come into simulation, you will get more out of it when you put more into it. And so this is going to work well for you if you play like this is a real patient and that you go through all the steps you would with a normal patient in real life. So just like a real simulation and just like a real hospital day, you would knock before you come in, and the first thing you would do would hand hygiene just like in a regular hospital. I want to orient you to things that you'll find in simulation and things that you'll find in a regular hospital room. You'll see gloves on the wall. There will be a welcome board that has all patient information and goals for the day. This is going to be your supply cart, things that you would need to start IVs, do blood draws, put away sharps, alcohol pads. Your hand sanitizer is going to be on the cart, and in the drawers is going to be different things you would need depending on the type of sim that your instructor is running that day. This will be your med cart. We will store meds in here. They'll be labeled properly. You'll always have a drug book available to you in your simulation situation. There's also hand sanitizer on the cart as well. So in the back of each simulation room, there's going to be a separation. This partition is going to simulate a separation from the patient's room, and it's going to be the nurse's station. So back here, there's a phone, and it's where you would call pharmacy or lab or physicians. And so before you come to this other side of the partition, make sure that you have your S-bar ready, make sure you have your lab, everything that you're going to tell the physician ready. Always have pen and paper ready to take orders from physicians. So this is where you would be when you are calling at the nurse's station to a physician or receiving a phone call from lab. You would pick up this phone. The number for the hospitalist is going to be sticky noted on the wall, and in order to help with your S-bar report, we do have an S-bar sheet right here on the wall for you to look at for reference. So when you get into your simulation, depending on what your instructors have prepared for you that day, there could be an array of problems with your patient simulated with the mannequin. So this mannequin can do a lot of different things. You can start an IV in his arm in this place right here. Your instructors will give you more information on that. He can talk, he can blink, he can move his mouth, his chest rises and falls with respirations. He has bowel sounds. Depending on what your instructors prepare, he can have any sort of illness that you need to be prepared to take care of. So in order to get what is vital, we have a pulse oximeter that goes onto the patient. In order to get your vital signs to populate on the monitor, this needs to be on the finger of the mannequin. So now that it's on the mannequin, you'll see that the screen behind me starts to beat because it detects the mannequin's pulse that your instructors have done the values behind the partition. In order to get real values on this screen, it is touch screen. So while we have a pulse ox set up on the screen, we still need to touch the part that says touch when leads off, and then we'll get a heart rate up here. And then touch when cuff attached. So you'll touch this part and you will start, stop button will get you a blood pressure. On the monitor, you're also going to find where your respirations are in white. The AWRR is going to be what your respirations are. If you need to take a temperature for your mannequin, which is part of your vital signs, you'll find a temperature on the bedside table next to the bed. Other equipment you're going to see in Simulation Lab is going to be a blood pressure cuff on the left side of your mannequin. And you can take a manual blood pressure if you'd like, as well as read it from the monitor. The IV pump that you will see is real. You can turn it on. IV tubing will go through it. Whenever we have fluids hooked to our patient mannequin, you will always see the clamp clamped. One rule that we do have with the mannequins is that we don't run any actual fluids into the mannequin whenever you start an IV. Other equipment you'll see on the back is to simulate a real hospital room. You'll see oxygen and you'll see medical air. You'll see suction and the suction gauge to the left. This doesn't work in real life, but it is to simulate real oxygen and airflow. We have oxygen tubing that you can place on your patient if your simulation set requires it. So when you come into simulation, you always are going to want to do a head-to-toe assessment on your patient, just like in real life. For assessment with the mannequin, it's going to be a little bit different, but mostly similar. You can assess pupil size. The mannequin does blink. You can check inside the mouth, inside the nose, and in the ears. When you get to assessing the torso, you will have listening icons that you can see very faintly on the chest of the mannequin. You'll be able to listen anteriorly. Go through the motions and go ahead and listen to your patient in simulation anteriorly and posteriorly, but you will only be able to hear the sounds on the anterior side of the mannequin. You can also listen to vowel sounds. When looking for pulses on your mannequin, you can find them bilaterally in the radial area and also in the pedal area. In conclusion, a lot of the things that I want you guys to know about sim is just a reminder that we do not run fluids into the mannequin, and a really big reminder is that we do not bring ink pens around the mannequin. The ink will absorb straight into the skin and it just won't come out very well. So just make sure that you be aware of those rules. Simulation is supposed to be a fun, a safe environment. It's where you learn how to take care of patients in a controlled space, where you can make mistakes, be corrected, and then in turn be better for your patients. Well, I think that about wraps it up as far as orientation to simulation lab. And remember, the mannequin is interactive and he will speak back. Is there anything else that I forgot, Mr. Mannequin?
I think you got it all, Miss Jackson.